Man does not live by bread alone, but by every word that comes forth from the mouth of the Lord. Here's a bit of trivia for you. Where does the word quarantine come from? We should probably know that, given the time in which we live. Where does the word quarantine come from? It comes from the Latin word for 40. You can already hear the biblical overtones there. Quarantine was initially employed when a returning ship was found to have numerous members with a disease, and so it was redirected to an island, and they would disembark for 40 days and then be on their way to their home. So originally, quarantine situates the physical within the spiritual. As numbers often are, 40 in Scripture is symbolic. Unlike the way our minds work, 1, 2, 3, 40. No, it's symbolic in Scripture. It means something like the amount of time necessary for a fitting completion, for the task or event to be brought to a proper conclusion. 40 days and 40 nights. It means the time necessary to accomplish the task at hand. In the first reading, it was the time needed to test the Israelites, to prove them and form them to look to God for their nourishment, and to understand that human beings cannot live if they are spiritually starved. This truth is present in our gospel too. In Greek, two words are used for life, bios and zoe. Bios, you can hear it, is biological life, organic life, life which requires the physical world. Zoe, on the other hand, is fullness of life, deep richness of spirit. Jesus did not use bios in the gospel we just heard, but zoe, which reinforces the experiences of the Israelites and identifies this type of life as springing from the privileged encounter with him in the mystery of the Eucharist. There's where you can be truly alive. Human beings are not content with mere biological life. Who of us has been alive and never, ever dissatisfied? No. We all have life, but we want something more because we're made for something more than bios. What I've noticed during our quarantine, during this time of testing, during the pandemic, is that this distinction and comparison has generally not been made between bios and zoe. By and large, the comparison which has been made has been between bios, physical life, and the economy. How much impact to the economy can or should we endure to save life? There's been some, though not much, weighing of the mental health effects of the lockdown, but spiritual effects? Come on. Liquor stores are more essential than churches in the eyes of the law. Religion's value is either misunderstood or denied. For example, this is glaringly obvious in the double standards required of churches by the governor. Interior door hardware must be sanitized before people exit. Never mind that the interior door hardware isn't used as you enter. Set that aside. When have you seen a convenience store clerk sanitize the door hardware after someone exits? Or the gas pump after they leave? When have you seen a liquor store employee sanitize a bottle of spirits that's picked up and returned to the shelf? Or a grocery store clerk wiping off produce after it's examined by the shopper? There is nothing during Mass which qualifies as direct contact as the KDHE defines it. But I just had a parishioner text me after the latest adaptations here, saying that the KDHE says people are more likely to contract the virus at church than other places. Really? Have you been to a gym since they reopened? With people huffing and puffing with no masks and soiled rags left out to be used again and again to sanitize? Or our reopened restaurants with dining rooms, low ceilings, En masse people sitting next to non-immediate family members, chatting for as long as you like, while here, 45 minutes and you're out. No singing. Don't sit next to anyone but your immediate family members. Can you say double standards? It betrays a lack of appreciation, if not of prejudice. There's no regard for Zoe, for life beyond the physical out there. And this is not without consequences. Here's what I'm beginning to see. I see it in younger adults. I hear it from younger adults, confessions elsewhere. Online Mass, Father, is hard for us to stay tuned into. It's not the same, and I find that kind of fading away. I hear it especially from older folks who have had their lives upended, often done so out of fear. Their support system, all the spiritual good, their community, social life, good work, volunteer work, just pulled out from under them, and they're at a loss. 2 pastors just recently shared with me that their senior associates, that is retired priests who are in residence, helping out with masses and confessions, going to hospitals, other things, they have shown marked cognitive decreases during this time, when everything that they had been doing, nearly everything, had been removed from them. It reminds me of what happens when well-intentioned adult children relocate their older parents from a place where they've lived throughout their lives to be closer to the adult children. And I've seen it again and again. The older people who are relocated are at a loss, often displaying great memory loss. Their life has been upended. Such is what I'm seeing here: darkness, uncertainty. Adult children, I'm one of you with parents over 65. Do not underestimate the amount of influence that you have on your parents, even though you may not think you do. I see it. It's inaccurate to weigh stay safe at home on the one hand with go out and get sick on the other hand. For there's more evil in the world than COVID-19. Isn't it ironic that a society that puts people to death because their quality of life is deemed inadequate, in the case of the pandemic, has decided that quality of life can or should be compromised so that biological life may be extended? Is this confusion or an agenda? Be careful how you influence your parents. There is more to life than bios. Just to put things into perspective and communicate what's often unreported because it doesn't instill fear and sell commercials, advertising. Here's some data from 2 Wall Street Journal articles. More than 95% of people who have died in the UK had at least one underlying condition. Italian public health officials have also reported that 96% of deaths involved one chronic condition and 60% had 3 or more. Nursing homes account for more than 50% of COVID-19 fatalities in 30 or so states. Most people over 65 who are generally in good health are unlikely to die or get severely ill. In Spain's national antibody study, 92% of those infected from the ages of 60 to 79 have mild or no symptoms, and fewer than 10% die. And for most people under 65, the risk of dying from COVID-19 isn't much higher than from getting in a car accident driving to work. And if you're under 50 with no serious health conditions and you don't live in New York, your risk of dying is around 1 in 50,000, similar to the risk of dying in a fire. I was just visiting with a man that I've worked with for over 15 years in New York. He said his entire building has been closed except for his offices. Many have closed permanently. He said, yes, you see a lot of cases and many deaths in New York. He said, but that's because we have millions of people. The vast number are in underprivileged areas. He said, but the media does not report that. He said, they do us no favors. I thought that coming from someone who's living at the very center of this. There is reason to be cautious, especially if you're vulnerable, but there don't appear to be grounds to let fear govern and darken your life or the lives of loved ones. For man does not live by bread alone. In closing on this great feast of Corpus Christi, let me share some images which have been on my mind this week as I reflected on this feast. They're images all from parishioners here. The mom with her 2 young kids in the parish hall for the streamed Mass every weekend. The married couple with their 2 very young kids attending every Thursday evening Mass and helping to sanitize afterwards. Last Sunday for communion after the 10 a.m. Mass, an elderly woman pushing her walker to the parish hall with mask on and 90-degree temperatures for the Eucharist. And another one walking in with her cane. A husband and wife, first one, then the other, come after the 10 o'clock Mass, about 2 minutes apart, so that one can save the kids out in the van while the other one receives Holy Communion. What a witness to the kids and to one another, that man does not live by bread alone, which remains true during these 40 days of quarantine. And so I must ask you, is it time, do you think, for you to come home?